Okay, everybody, we're going to move on to Chapter 42, Disorders of the Skeletal System. We're going to start with just some common joint injuries that you hear and see a lot of all the time. First of all, you have strains. Those are injuries to muscles where you have a stretching or a partial tear in a muscle or a muscle tendon unit. Usually, signs and symptoms of a strain include pain, stiffness, swelling, tenderness to the local area. Now, injuries to ligaments are called sprains or ruptures. This actually involves the ligament itself and the surrounding area in the joint. You can have an incomplete or a complete tear, which is also known as a rupture. Signs and symptoms include pain, rapid swelling and discoloration to the entire area, heat, and limited function. Swelling that you see with a sprain is going to last longer than just a muscle strain. The most common site that you see a sprain is an ankle, followed by the knee. Now, a lot of times we see it's very common for people to have a torn or a sprain or a rupture to their anterior cruciate ligament or their ACL, and you rarely hear somebody say, oh, I sprained my ligament or I ruptured my ligament. They usually say it is torn, and that's okay. They use different terminology, but it is still actually a sprain. Injury to tendons, rotator cuff injuries, we'll talk about that in just a minute. A dislocation of a joint means the bone ends have been displaced from their area in the joint capsule, meaning that they don't meet anymore. Common dislocations are in the shoulder and the knee. Loose bodies are little pieces of bone or cartilage in the joint space, maybe from some type of trauma. Those little pieces can get caught in the joint space and cause a locking of the joint. And if they are left in the joint, they can actually lead to arthritis and sometimes cause a little bit of pain to people. Your menisci are C-shaped areas of fibrous cartilage in the knee that help with shock absorption and weight bearing. We mentioned these in the previous chapter. Anytime you have a problem with the ligament in the knee, there's also a chance of having a problem with one or both of the menisci. Most of the time you will have problems. You'll see a lot of athletes having meniscus injuries and ligament injuries, usually when they have a direct blow to the knee or from sharp pivoting. Just the activities like playing racquetball where you have to pivot quickly, or even with football where the players are actually being tackled and you have that direct blow to the knees. Chondromalacia means that you have softening of the cartilage. It's most commonly seen in the knee in young adults or athletes, mainly from overuse. They complain of pain with frequent squatting, bending, or stair climbing. You see this a lot in baseball or softball catchers where they have to squat frequently. Again, anytime you see malacia on the end of the word, that means softening. So in this case, we're talking about chondromalacia or softening of the cartilage. You can treat this with rest, and even some isometric exercises can help sometimes. Continuing with common joint injuries, specifically rotator cuff injuries, you've got to think about how complex the area of the shoulder is. There's a series of joints that provide range of motion there. The humerus, the clavicle, and the scapula, and then all of their connections with each other. So it's easy to see how injuries can occur to that specific area. Maybe you can have clavicle fractures, you can have dislocations, bursa damage, or even torn tendons. And this can be a result of overuse, direct trauma, stretching injuries, usually involving throwing or swinging, baseball pitchers, tennis, people who play tennis who use their shoulder repetitively or repeatedly in the same motion can cause rotator cuff injuries. And then you have hip injuries are the last common joint injuries. Dislocations of the hip are considered disease because there's actually an interference of blood flow to that area. Also very common to have hip fractures. They're a major problem in our country, especially in the elderly, usually caused from falls. It causes a lot of hospitalizations. Basically, the continuity of the bone is interrupted when you have a fracture of the hip. And it can lead to problems, especially in the elderly population after they have a broken fractured hip. They usually have to go on to have fixation of that fracture and sometimes even a hip replacement. Here you see a pretty good picture of the hip with the patella that's actually folded down, so you can see the internal ligaments and the area a little bit more clearly. Obviously, we've already said that you can have injury to one meniscus or even both menisci, particularly common when you have a ligament. Patellar or knee dislocations can occur from sports like skiing or tennis. Patients often say they feel like the knee is popping out of place. You also have some swelling, stiffness, or decreased range of motion, and it's actually very painful when they have those dislocations. And then last, we've already talked about chondromalacia, which is softening of the cartilage. In this case, you could have softening of the cartilage around the knee. Fractures are the most common type of bone lesion that we see. They can be classified three different ways. Number one, by sudden injury. They can be classified by cause. One cause would be sudden injury. Second cause can be fatigue or stress fractures. And then third is your pathologic fractures, which are fractures that are in bones that are weakened by disease or tumors. Most of the time you see that in patients who have a cancer, a bone cancer, they fracture easily. They're also classified by the type of fracture, which is what you see here on the slide. Different types there. You can see the transverse, oblique, and spiral. And you can look at those in your book. I could definitely put a picture of a fracture on the test, and you would have to tell me which type of fracture it is. So I would just be familiar with those. They can also be described as either open or closed, which is basically talking about the relationship they have with the outside environment. Are they open to the environment, or is the fracture closed? Has it broken the skin? If it's broken the skin, it's open. If not, it is closed. The name for open is compound fracture. So we have classification by cause, type, and then whether or not they are opened or closed. And again, you're responsible for reading in your book about the different fractures. Signs and symptoms would be pain, tenderness, swelling, loss of function and mobility to that area. Of course, you diagnose the fracture with an X-ray. Now, treatment depends on the type and the severity of the fracture. I would like you to know the three-step process in treatment of a fracture. Now, obviously, if you ever were out in the field somewhere, if you came upon an accident and whatnot, and you thought somebody might have a fractured uh, femur or any other type of bone, obviously what you're going to do first is immobilize the area. Okay, that is a given. But what I'm talking about here, as far as treatment goes, is for the initial stabilization. Just say you're working in the emergency room or on a med-surg unit and you have this patient that comes in. They've already been stabilized and their fracture has actually been immobilized out in the area or in the field wherever they had the fracture happen. So what would be your first course of action in treating the actual fracture? Well, first of all, you have to, we call reduce the fracture or a reduction, meaning that you move the bone fragments back into place as close to normal as possible. You may have an open or a closed reduction, depending again on the type and the severity of the fracture. If you have an open reduction, then that means the patient has to have surgery. Sometimes they'll have to go in, put in pins, rods to put the bone back together as closely as possible until actual healing can occur. Sometimes, just say you break a finger or even an arm, sometimes they'll actually, if the fracture is closed, they will come into manual manipulation, basically without even giving you any pain medicine or anything. They come in and just move the bone back into place, which really hurts pretty badly. So that would be your first step, reduction of the fracture. Number two, after the fracture has been moved back into place as close as possible, you're going to immobilize the area until actual bone healing can occur. And then three, you're going to preserve and restore function. What type of rehab are they going to have to restore their function of the fracture after, say, the cast or the immobilizer has been removed? So, number one, reduction of the fracture. Two, immobilization of the area for a certain amount of time. And then three, preservation and restore the function. So with that, let's go ahead and talk about a little bit about bone healing. It's basically a four-step process. In the beginning, after the initial fracture, you're going to have a hematoma that forms, okay? Usually forms within 1 to 2 days after the fracture. Second, a fibrocartilaginous callus develops, okay? That's a fibrocartilage callus that develops. And you got to remember, throughout this particular step, you have your osteoclasts that are coming in, your bone-chewing cells that are kind of cleaning up the area. For step three, where you have ossification, which is where your calcium salts are deposited into the new tissue. So during this particular step, you would have your osteoblast, your bone-building cells that are coming in to release or cause a release or production of the calcium and the phosphate that's going to actually lay down the extracellular matrix and cause hardening of the bone, the new bone. And then the fourth step is remodeling. The new tissue is remodeled into the normal shape. Some complications that can occur from soft tissue injury. Obviously, you can have injury to the skin over the area of the fracture, such as blisters that can occur. Muscle injury and swelling is defined as compartment syndrome. And I do want you to know a little bit about that. Just think about, with compartment syndrome, there's basically increased pressure in a very limited space. Now, your bones and your muscles and nerves of an extremity are located in a muscle compartment. Whenever you have bone surgery, they have to actually enter into that muscle compartment and manipulate the actual bone. Now, with that manipulation, it can cause bleeding and trauma into the area. So after they've finished up the surgery, closed up with incision, you can actually start to have increased bleeding into that muscle compartment. And just think the compartment can only hold so much. So as the volume of blood increases, that increases the pressure and can lead to significant tissue injury. The hallmark symptom of compartment syndrome is pain that's unusual from their original fracture pain or their fracture injury. They also start to have decreased sensation to the area, and their reflexes will be diminished as well. Their pulses may be decreased. We actually had a patient when I worked at Baptist East that I believe he had had back surgery. I can't exactly remember, but anyway, they had actually had to manipulate one of his lower extremity compartments with that lower back surgery. And the following morning, after the anterior posterior lumbar fusion that they did, he started to have right leg pain, and the nurse was doing her appropriate neurovascular checks to his pedal pulses, and she noticed that he was losing sensation to that right lower extremity, and that his pedal pulses were decreased or diminishing. They actually had to take him back to surgery for compartment syndrome to that right lower extremity, open up the muscle compartment. They left it open, but he had already lost enough circulation that caused enough damage to that leg that they actually had to amputate his leg due to the compartment syndrome. So it is a definite emergency. And that just shows you how nurses are very important and play a crucial role in assessment. The nurse was responsible for doing neurovascular checks, which includes pedal pulses to those lower extremities every 2 hours, I believe it was. So she called it early on. Unfortunately, it was already it was filling up so fast. The pressure had increased so fast that they weren't able to save that leg. Nerve injury, specifically reflex sympathetic dystrophy. This occurs when you have nerve injury along with fracture, causes patients to have severe burning, aching pain, and can cause them to have abnormalities in their autonomic nervous system, increased flushing, sweating, and whatnot. Osteomyelitis is when you have an actual infection of the bone, usually through a direct contamination, like with a fracture, or if they've had to have surgery in open reduction of a fracture. Very common in patients who have diabetes, who already have a decrease in their peripheral circulation. You see that in your diabetics who have the skin lesions a lot in their lower extremities, also can develop osteomyelitis. These patients are very sick and usually have to have strong antibiotics for their treatment, usually strong IV antibiotics. Their signs and symptoms resemble septicemia or cyst bacteria in the blood, fever, chills, fatigue, and again, they usually, if it's bad enough, they may actually lose toes, feet, wherever the osteomyelitis may be, and strong antibiotics to take care of the infection itself. You can see here, this is all we're going to talk about here. Usually you see chronic osteomyelitis in people who have open wounds. Again, very common in your diabetic patient. And you can see here areas of dead bone that develop and surrounded by areas of new bone that you can see on the X-ray. Osteonecrosis is caused by prolonged ischemia, a lack of blood flow and a lack of oxygen to bone due to some type of bone injury. Maybe they had a blood clot within the bone or vessel injury. Again, compartment syndrome inside the bone itself where the pressure increases. inside the bone. Sometimes patients who have to take long-term steroids, like your COPD patients, your chronic lung patients who have to be on prednisone long-term to be able to breathe, they are at risk for osteonecrosis. It actually causes you to have some bone abnormalities and can increase ischemia, causing necrosis to the bone. Shifting gears here to tumors, starting with your benign bone tumors, osteomas are small bony tumors on the bone surface. Chondromas are cartilage tumors. Osteochondromas are cartilage cap tumors with a bony stalk. This is the most common type that you see of the benign bone tumors, osteochondroma. And then you have osteoclastoma, which is an actual cell tumor. It behaves like a malignant tumor, even though it is benign, because after they remove it, it usually comes back. Most commonly seen in young women in the knee, wrist, or shoulder. Most of the time, people will actually have to have radiation to prevent the tumor from coming back, even though it is benign. It has some of those malignant characteristics. Malignant bone tumors, you have osteosarcoma, which is the most common primary malignant bone tumor. You tend to see this in areas with the fastest bone growth, usually in the knee, tibia, fibula, femur. A lot of times it will metastasize to the lung. And the most common sign or symptom is that patients complain of waking up in the middle of the night with pain in the affected area, and they'll usually have some swelling. Ewing sarcoma is one of the members of the small, round, undifferentiated tumors of neuron origin. You see this more in your younger patients, children and teenagers. Chondrosarcoma is a malignant tumor of cartilage, and then metastasis accounts for the majority of your bone malignancies. Most of the time, people who have bone cancer, it is usually metastasized from some other location. The goal for patients who have bone metastasis is to try to control their pain and to prevent them from having pathologic fractures to that diseased bone. Manifestations or signs and symptoms of bone cancer are just like pretty much with any other type cancer. You are at risk for changes in the organ function, specifically pathologic fractures, because the bone is actually weakened, so they're very easy to break. Local effects of tumors, think about how you can have compression on nerves or veins, or you may have nerve pain, bleeding, weakness and fatigue. Non-specific signs of tissue breakdown. Obviously, we see the protein wasting. With bones specifically, you might see hypercalcemia because of the breakdown of bone. You tend to have the release of calcium and phosphate in blood, which can cause hypercalcemia. I used to go into great detail about variations in normal growth and development, but I think I'm going to save this for pediatrics. The only thing I really want you to know about torsional deformities is the difference between genu varum and genu valgum. This is bowed legs and knees. Genu valgum is knock knees, which you can see there, a sweet little boy that has the knock knees. Think about gum stuck together. The knees are come together almost to a point, and then the lower aspect of the lower extremities kind of go out. And then the verum, the genu verum, are the bowed legs that you see there. It's obvious one is which there. And that's really all I want you to know is the difference there between the bowed legs and the knock knees. Again, I'm going to save this slide until you get to pediatrics, where y'all will talk more about the different foot deformities that you see. I do want to talk in particular on this slide about osteogenesis imperfecta. Basically, children are born with this. They have mutations in their genes for their collagen. It affects their collagen and formation. And these children will have severely fragile bones, very low bone mass, and that results in lots of breaks. I mean, lots of breaks. They can just fall real easily and break a bone. I have a patient now in the clinic that has osteogenesis imperfecta. She's a teenager now, but when she was a baby, she had several breaks within a year or two's time, and they actually reported her mother to DHR because they thought she was being abused. And it turned out after further testing that she actually had this malformation, osteogenesis imperfecta, and she still occasionally will have some broken bones. She just has to be very careful with how she acts and the different activities that she does. And last for this chapter is scoliosis. I think everybody knows about scoliosis. Basically, you have a lateral curving of the spine, okay, curvature in the spine, usually results in an elevated shoulder or a hip that sticks up abnormally, causing, again, the curvature in the spine. Depending on how severe the deviation is, they may put on a brace. If it's even worse, they may actually perform surgery. The braces have really helped pretty significantly now, so that people have to have the surgery so much. You see very mild cases and very severe cases sometimes. So again, it depends on how curved the spine is as to what type of treatment